So last week I interviewed Sean Flynn on the Singapore healthcare system, and I thought that for today's classic interview, we'd go back to an interview with former CIGNA executive Wendell Potter, who's been on the program a number of times. He's talked about his great book, Deadly Spin, which, by the way, is several years old now. If you haven't read it, I highly recommend you check it out. And we interviewed Wendell Potter specifically about the United Kingdom's national healthcare system. And we went through many of the common talking points from the right who like to talk about just how absolutely terrible the British healthcare system is. And in particular context with the Singapore healthcare system, we're going to go back to this interview from March of 2015 with Wendell Potter to review how a totally nationalized healthcare system can work. And again, the broader context for me is thinking about how might we be able to improve the American healthcare system? Whether you like or dislike the Singaporean healthcare system, whether you think that the British healthcare system has problems, what's abundantly clear from any measure of the data is that the system we have here is an absolute and total disaster. So let's go back to my interview from March of 2015 with former health insurance executive Wendell Potter. I'm joined today by Wendell Potter, who is former VP of Corporate Communications at CIGNA, also author of the book Deadly Spin, and most recently, Obamacare, What's in It for Me? What Everyone Needs to Know About the Affordable Care Act. Wendell, it's great to have you back, of course, and you recently wrote a very interesting article talking about the United Kingdom's national healthcare program that they have. It's a topic of much controversy. It's often used by those in the U.S. who are against any kind of government involvement in healthcare to point to other countries that have government healthcare programs and to talk about how poor they are, the long wait times, the very high cost, the spending per person, the high tax rates that people in those countries have as a result of these government programs. You looked specifically at the UK, and maybe not surprisingly to some of our audience, a lot of those talking points seem to not be true.
Oh, you're exactly right, David. And I even mentioned in that post that during my career in the insurance industry, I used to spend considerable time trying to mislead people about the National Health Service in the UK and the Canadian health system and other systems that were single payer or that were very heavily regulated by the government, which is every other healthcare system in the developed world.
So let's go through what we do know and kind of these objections that become part of this mantra that is against these types of programs. With regard to what we hear about accessibility of care, long wait times, etc., what's the truth about the UK NHS system?
Well, the truth is that on almost every measure of outcomes and patient satisfaction, the UK is way ahead of the United States. And what I wrote about in that piece was first-person accounts of people who are either expats from the UK and have lived in the US, or people who have dual citizenship and have used both systems. And without any hesitation, they all said that they would much rather get their care in the UK. Some people said that even though they were living in the US, they would fly back to the UK to get care for a lot of reasons. One is the cost. It's much less expensive in the UK. And second, it's far less complicated. We have I guess, probably the most complicated healthcare systems on the planet.
And when we look at the outcomes, I think that this is a really interesting element, because if we put aside for a second long waits, in many cases, those are kind of anecdotal stories that we hear about long waits. So if we put that aside for a second, particularly when it appears not to be true broadly either, when we look at outcomes, we often hear touted that in the US, in spite of the fact that we have a kind of employer-connected and or private insurance system as the predominant one, that the outcomes are actually better here. Are there some specific statistics or conditions that you can talk to us about that illustrate why that is not true?
Well, you're right. The arguments against the National Health Service that have been put out by opponents here in the U.S. Are anecdotal. I mean, they are anecdotes, and they're done specifically to obscure the reality of the better outcomes. The Commonwealth Fund every year does an analysis of the healthcare systems around the globe and in the developed world, and they rate them as to on various measures, on outcomes, on accessibility, on cost, among other things. And last year, the UK system came out well ahead of every other system, and certainly well ahead of the UK system. They looked at 11 countries. The UK was first, and the US was 11th. Now, hopefully, the US will start to climb up because we passed the Affordable Care Act, and that survey or that work that was done by the Commonwealth Fund was based on the experience in 2013, and then the next year, 2014, last year, is when a lot of the provisions of the Affordable Care Act kicked in. But to answer your question, a lot of the outcomes in the UK are much superior to ours. One of the things that it's really important is access to primary care, which is much more readily available in the UK. And one of the reasons why they have they have better infant mortality statistics and longevity statistics.
Let's talk a little bit now, if we concede temporarily, even though, as we know, there's no reason to do this, but if we were to concede that let me frame it a different way. Let's focus just on this issue of taxes, right? So if we can say, okay, we can have a system that works well, that is either private insurance or government funded. We can have a system that works well, that is a government system where you can have either a social safety net or straight up single payer health care. But the problem is that it's very expensive to taxpayers. If we analyze that data, I looked specifically at Australia as well as at the UK. It does not actually appear that there is a significantly higher tax burden for individuals based on having that national health care program.
No, you're exactly right, because of the efficiencies that you can get in a system that is operated largely by the government, or at least financed by the government, in which you can remove a lot of the hidden costs that we have in this system, a lot of the administrative expenses that that make our healthcare system the most expensive in the world. We spend, it's been estimated about 30% of what we spend on healthcare is, in many cases, wasted, or at least characterized as administrative expenses that don't have anything to do with the delivery of care. So you save that money right off the bat. And one of the things that it's difficult for advocates of reform to communicate effectively to Americans is that we pay a lot in a hidden tax for the care that we get, for the insurance that we get. We tend to think that if we get our coverage through the workplace, that's our employer taking care of that. But actually, it's our money. So what we need to do is consider all that we spend on health care, and including what we spend on premiums, and we can see that it's far and away much more than any other country spends.
I want to go back to something you wrote about in Deadly Spin, and I often reference this, but over the years, since I've read this passage now a few years ago, I forget some of the details, and I think it would be very interesting to review. You wrote in the book that the U.S. at one point was actually early in the 20th century going in the direction of single payer, and if I recall correctly, because it was similar to what our enemy Germany seemed to be doing, there was a successful campaign mounted to oppose going in the direction of single payer merely because it was similar to what our enemy was doing. Am I remembering that more or less correctly?
You really are. In fact, we have been trying to reform our healthcare system for more than 100 years. It goes back to the administration of Teddy Roosevelt, who was trying to do exactly what you described. But there was a fear-mongering campaign that developed even back then to try to scare people away from the German healthcare system. Germany was one of the first developed countries, I think it was the first in Europe, to go down the path of providing healthcare more broadly for its citizens.
And when we look going forward, you know firsthand about the propaganda campaigns that have been used here in the U.S. from the for-profit insurers to put down the programs like that originated in Germany, in the UK, in Australia, etc. What might get the dialogue to change successfully in terms of having serious conversations around national health care? I mean, we know that when you fairly ask individuals, do you believe the government has some responsibility to provide at least basic care for everybody, regardless of ability to pay? That's actually very popular. But when it gets wrapped in around corporate talking points is where it seems to fall apart.
It's exactly right. Corporations that offer or sell health insurance are very, very profitable, and they have a lot of money to invest in PR campaigns to mislead people. So we've got to realize that's why I wrote Deadly Spin, to explain to people how that works. We've got to come up with strategies that can overcome that, and I think it's possible. We just have to know to start with what we're up against.
All right, we've been speaking with former VP of Corporate Communications at CIGNA, Wendell Potter. One of the books, Deadly Spin. The most recent book, Obamacare, What's in It for Me, What Everyone Needs to Know About the Affordable Care Act. Thanks as always, Wendell.
Thank you, David.